Hi, guys. Good morning. Welcome to another session of AMA with Dr. Ben. I'm Dr. Ben Benham, one of the co-founders of Happy Head, and I hope you guys all had a great Thanksgiving turkey. And we're ready to start another session. So, anything we should start off with, Evelyn, this week?
The question
Here we go.
is, why is Happy Head better than other brands?
Oh, great. So, why are we basically so unique? So, this is what makes us unique. First of all, we have more ingredients in our. First of all, we're topical compared to oral. We're the first topical finasteride in basically nationally distributed in the U.S. market back in 2020. That's when we started. So we really have more experience than anyone else. And prior to us becoming live nationwide, we were in my office for almost 3 to 4 years, really testing the product out. We're looking in Santa Monica, California. Number two, we're customizable topical finasteride, which means that if there's something wrong with the product or if you want to lower the concentration, we could totally do it. Whereas with other brands, just one size fit all, is mass produced, sitting on a shelf. But with us, we literally produce it on a monthly basis. This is why we're able to kind of change it as we go along. This morning, I was talking to a patient who wanted a lower concentration of minoxidil. I'm like, sure, no problem. We'll take you down a notch. And he didn't want the aloe in it, so we're going to take that the aloe. So there's a lot of stuff that we could really do with the product that other companies cannot do. There's a customizable topical finasteride for our patients. Also, we have more ingredients than all our competitors. We have finasteride in the product, minoxidil, retinoic acid. We also have another product that has finasteride and dutasteride and minoxidil and retinoic acid, whereas our competitors only has finasteride and minoxidil, which is not customizable. So those are what really makes us unique. Okay, guys. So let's see. Have you seen people get skin infections from using a derma roller? If yes, are those only minors like facial blemishes that go away, or do they have more severe with the need of antibiotics? So, great question. I've never seen anyone get a skin infection with derma roller. I mean, and also we're using the 0.25 derma roller, so it's not very deep. But I've been using derma rollers in my office for almost 6 years now. And also, I do a lot of stem cells and PRP where I'm using the 1.5 millimeter derma roller, and I'm very aggressive. And I've never seen it. I'm not saying it's not possible. I've never seen it. What I recommend is I basically get an alcohol spray bottle and spray it down before after use, and change it frequently, like on a monthly basis. I mean, those derma rollers are pretty cheap, and I think if you email us help at Happy Head, we'll throw one in for free. We don't even charge you.
Pharmacy's not sending them, but we can send some out from here if necessary.
Oh, I see. Okay. I mean, if you apparently the pharmacy is not sending them, that's what I just learned. But we'll be more than happy to send you guys out from our office in California. So just let us know. I mean, I think the cost of those, like, you could buy them online, is like 15, $20. But we'll give it out to you guys for free, guys. Don't worry about it. Just let us know.
Often should they be replaced?
Look,
To usage.
look, if you're using it every day, you should probably change it every once a month to every 6 weeks. I mean, if only using it twice a week, obviously it's gonna last longer. But I recommend like about once a month. But definitely get an alcohol spray bottle and spray the derma roller. Obviously, if you make yourself bleed, then you really want to switch that much earlier. And also, if it's looking like weird and like fungusy, obviously throw it out. After applying the solution, my hair feels stiff. Can anything be done to lessen this effect? Yes. The reason why it feels stiff is because we have aloe vera in the product. We could take the aloe vera out. Please email us at help at Happy Head and just say, please remove the aloe vera, and we'll be more than happy to do that for you. Happy holidays. I've been using this product for a month now, and my hair is falling out much more than before. Is this normal? Yes, it is. The reason is because of the minoxidil could sometimes cause an initial hair loss, which may last 6 to 8 weeks. This is normal. This is normal. In fact, patients that have initial hair loss will have much better results. The reason why you're having the hair loss is because these are the weaker hairs that you're going to lose anyways, and minoxidil just resets your hair cycle, so that's why you're going to lose them a little bit faster at the beginning. Obviously, let's say if you do it for 3 months and it is not, it's not going, the hair shedding is not stopping, then let us know and we'll take out the minoxidil. I was talking to a patient this morning, and he was around week 8, and he was telling me that the hair loss had already slowed down, which is normal. So again, keep in contact with us. See how it does around the 8 weeks mark. Let us know, and we'll go from there. If we need to, we'll be more than happy to remove the minoxidil, the product from your Happy Head product. Will you send a recording of this to those that RSVP? Great question.
You have to email us.
Can you please send us an email? I mean, I know it's placed on our one of our website.
Here also.
Save where?
If it's always on the website, there we have access to all paths.
Yeah. So you could have. Do they have access to it? So you could actually you have access to. First, I thank you, Evelyn, for answering all these questions. Jordan, we're missing you, but I know he's somewhere listening to us. So you could access all of our AMAs on our website. But if you email us, we'll be more than happy to send you this today's version. No problem. And we also post on our YouTube channel, which basically is at Happy Head on YouTube. Minoxidil 8%. What is the risk involved when all other products on the market top out at 5%? So the risk, it's just more irritation. I mean, obviously, minoxidil, one of the some of the side effects of minoxidil includes headaches, heart palpitation, dizziness, lightheadedness, chest pain, shortness of breath. But those are all honestly really rare on on the topical. I mean, we have patients take the oral minoxidil, so you're getting a lot more exposure. But the topical usually has side effects of irritation. And again, we've been using minoxidil for God almost, if you include our office use, almost 6 years now. They're at that percentage, 8%, and patients do very well. Now, there are other companies, believe it or not, that have the minoxidil 12%. I think that's just way too irritating. So that's why we didn't go above 8%. And also, when we formulate the Happy Head product, we did a lot of testing, and you cannot get beyond 8% to dissolve in the solution. So if you add 9%, it actually precipitates out of the solution. That's why 8 is the max.
Is that also why you can't include anything higher than 0.1% in like the advanced formula when you have all three of them together?
It's just we just didn't want to make it too irritating. How often should a dermal roller be used after each twice the application or maybe once every other day? So it really depends on how you want to use it. Our recommendation is to use it once a day daily, just at night, once a day. I don't know if anyone really uses it twice a day, but I would just keep it to once a day. Now, again, obviously, if you can't do it every day, doing it every other day is fine as well. Other products with a lower percentage of minoxidil and finasteride instruct their users to apply it only once a day, but Happy It suggests twice a day as a higher concentration of the drugs. What is the science behind that? So that's a very good question. So if you actually look at some of the clinical studies, and they're listed on our website, of topical minoxidil and also topical finasteride, you see that they were done twice a day. Now, if you look at minoxidil itself, the 2%, 5% of the counter is a twice a day application. Thus, even the 8%, we're still going to keep it twice the application. And in our own clinical experience, that means our own patients using this in our office and seeing them back every 4 months and 6 months, patients tell us that doing it twice a day, they got much better improvement than once a day. You're right. One of our good competitors, which I won't name names, they have patients only use it once a day, but they also have patients in a spray bottle, which you can't even know basically how much you're getting out. So we've done a lot of testing at the beginning. Basically, again, remember, we had this product in our office for several years before we launched it nationally. And we did a lot of testing, in our clinic. And, doing it twice the application gave patients better results than doing it once the application. Now, obviously, if you do it twice a day and you're having irritation, things like that, we have you go down to once a day. But doing it twice a day will give you better improvement. Again, what makes our product different from other options? Again, we're topical. We have more ingredients than our competitors, and we're also customizable. And we are always here to take care of you guys. Switching products out, giving out free dermal rollers, anything that we could do to make you guys happy. Does the strong consumer medicine yield better results? Typically, yes. If you look at the clinical studies of minoxidil 2% compared to minoxidil 5%, the 5% that's significantly much better than 2%. Although there are no studies comparing minoxidil 8% to the 5%, but based upon our patients who had used 5% previously, they tell us that 8% did much better. Is the spray version of topical financial more effective than a dropper? Great question. So, guys, I love these all questions because a lot of these actually they go back to almost 3 to 4 years ago when we were launching Happy Head and we were doing a lot of these web testings. So initially, actually, Happy Head came in a metal spray bottle long time ago. I will bring you guys one of these bottles. It's from 5 years ago. The problem with the spray is twofold. One, a lot of people basically have longer hair like me. The product gets stuck on the hair itself. So it's tougher to rub it in. Number two, you really don't know how much to really spray. Like if you do this, 5 sprays or 7 sprays, you really don't know. Number three, the minoxidil would plug up the nozzle of the spray. So then it wouldn't work. A lot of issues. We constantly had to basically change the bottle. So and it didn't make sense because if you look at the studies were you had to get a certain mLs basically every time you apply the product. So if you want to really do 1 ml twice a day, and if you look at the over-the-counter minoxidil, is also 1 ml twice a day. So we want to keep everything consistent. 1 ml twice a day, and it's very hard to keep at 1 ml twice a day consistently with the spray bottle. And also, I think you're gonna get trigger finger if you press it that many times every day. So, and the liquid is much easier. The dropper is nice, is elegant, is in a glass bottle. You just apply it, you put it directly on your scalp, and basically you press it, and the product basically is easily spreads throughout the entire scalp. Now, you could switch it out to a spray bottle. I'm just saying it's not as effective as using the droppers. What is saw palmetto and how does it work? So saw palmetto is a natural ingredient that increases blood flow to the scalp. Um, Obviously, it is not as good as minoxidil. It does also cause some tingling, so in the scalp. So that's probably doing something when you apply it. We do have it in some of our shampoos. Um, some some people take it orally. Again, hard to say if it's really going to work or not. So, but we do have it in our shampoos. Will I start to see improvement the first 1 month? Absolutely not. But some patients may, but typically no. Typically, the hair cycle takes several months. So for you to see improvements is going to take about 4 to 6 months to see the results. So please be patient. Honestly, any company that promises you're going to see improvement in 1 month, I don't think they're telling the truth.
Just the nature of the product.
That's the nature of the product is going to take 4 to 6 months. If I use the medication less than twice a day, will I still see results? Yes, you probably will. Probably not as good as twice a day, but you probably still will see results. Does washing the hair every day lead to hair loss? How often should I wash my hair? We typically recommend washing the hair every other day, so like 2 or 3 times a week. Well, actually, let me rephrase that. Shampooing the hair, we recommend doing it every other day. You could wash your hair every day, but just not shampoo it. Do you offer any products that can be used without a prescription? We are currently working on a serum that is also used for hair loss that is not prescription, but is currently not available. You're more than welcome to actually email us, and we'll keep you on a list. But that product is currently not available. We're currently working on it because we want you guys to get the best product out there. So it's currently in the works. When can I expect to see results? Typically about 4 to 6 months of use. Um, what if I'm starting to experience side effects with the medication? What should I do? One, stop using the product and reach out to us. And please describe us what side effects you're having. And based upon that, we're able to share our experience and expertise on how to modify the product. And we'll ship you out a new product for free so you could try it. You could also make an appointment with me, and we'll be more than happy to chat about the product. So just reach out to help at Happy Head, and they will help you. Again, you could also make an appointment with me, and we could talk about the product. just to get on a calendar schedule and we talk for 10 minutes and we've tried to figure out how to adjust it so we minimize and reduce the side effects. Is the foam version better than the pipette? I honestly, so we've tried the foam version as well. I honestly think the pipette is still the best in my personal experience. But some people like the foam, so that's different. But the pipette is just better application, easier to do. Um, do scalp massages really do anything for hair loss? It's questionable. Uh, it's questionable. In some people, yes, they do. I think the dermal roll is much better. I think there's a better job at doing the scalp massage and also does a better job at creating tiny holes into the scalp, thus allowing for the product to penetrate deeper and allowing you to give better results. Did the happy ingredients change? I had great results when I first got it and didn't dry and irritate my scalp. Lately, it's been irritating. No, the happy ingredient has not changed at all. I think what happens sometimes after you use the product for a while, your scalp might get a little bit sensitive to the minoxidil and some of the alcohol base. So, a couple of things we could do. One, if it's becoming too irritating, you could wash the product out after 1 or 2 hours and you will still get the same efficacy. Two, we could switch out the product to a water-based formula to reduce the irritation. Three, we could lower some of the minoxidil concentration because, again, as I said earlier, over time your scalp could get sensitive to the minoxidil in the product. Do laser caps work? So this is a great question. Uh, I think it's about 50-50. I think in half the patients it could work, and the other half it may not work. I do have a lot of patients that use it, and some patients they swear by it. But again, some it could be very expensive. So again, I would say about 50-50. I mean, if you already have it, use it along with the happy hit. How often should I wash my hair when using the product? Every day, every other day. Usually we're coming every other day. Product works great, but over time, especially recently, my scalp has become dry and irritated. Or did the ingredients change? I think it's probably the same person asking the question. The ingredients has not changed. I mean, we have not changed any of the ingredients. I think people's scalp just becomes more sensitive. So my recommendation is please reach out to us. We actually do have a scalp serum that we could send you to reduce some of the irritation. You could also wash it out after 1 to 2 hours. You could also cut down using the products from twice a day to once a day. And we could also switch you over to the water-based formula. But please email us at help@happyhead, and we'll be more than happy to assist you with the best direction to take from here on. Again, applying the solution, my hair feels stiff. Anything to do about that? We could take out the aloe vera. Is the aloe vera the reason why we have aloe vera in the product to reduce some of the stiffness? The reason why we have aloe vera in the product is to reduce some of the irritation that aloe could cause. How long after applying the 1 ml can I wash, not rinse, wash my hair? 1 hour. Leave the product about from 1 to 2 hours, and then you can wash it. You're not really gonna sacrifice efficacy that much at all. Should I expect a dread shed when switching from low to high concentrations? Typically not. If you're using the minoxidil already, your body should have already gotten used to it. So I wouldn't expect that dread shed. I'm on the 1 milligram of finasteride on topical Rogaine for a few years. I noticed that the thinning was getting worse. 2 months ago, I stopped the Rogaine and started the kitchen sink formula to get a boost from the topical finasteride, the dutasteride, and minoxidil 8%. Over the past couple of weeks, I've had bad shedding. Originally, my crown was thinning. Now the front is thinning as well. The shed is worse than when I started with a finasteride minoxidil. Is happy and making my hair fall out. So, couple things. So, you were on the oral finasteride for a couple of years. What happened was that when you stopped the oral finasteride, your body, you kind of disturbed the equilibrium of your body, and that's probably why you're shedding. Is the shock of not having the oral finasteride in your system. Remember, when you start topical happy it doesn't start to work right away. So my recommendation is that if you're on oral finasteride for a couple of years and you want to start the topical finasteride, I would probably overlap them Better yet, you will see better results if you actually do oral and topical finasteride together. But again, back to my point, I would probably overlap so you don't interrupt the equilibrium, so you don't get this shock loss from stopping the oral finasteride. Number two, happy it does have minoxidil in it, and minoxidil causes initial hair shedding. So in your case, probably I think is the combination of stopping the oral right away and the shock loss from the minoxidil. You're getting like a double shock loss. So this is what I recommend. I actually recommend you to go back on your oral finasteride, and it's because you really want to kind of either taper it or something doing together is gonna be better. Now the reason why you started the happy was because oral finasteride, basically the efficacy just plateaus or tapers down after a while, and that's what you had experienced. In those cases, what I do in my clinic is that I will keep the oral finasteride and add topical finasteride to it. So I probably would not stop the oral, just add topical finasteride to the regimen. One, you're going to avoid that basically shock loss from stopping the oral finasteride that your body has gotten used to, and two, you're probably going to see better results. If you have any questions and you want to talk to me individually about this, I'll be more than happy to help. You could just reach out to the help desk, and they'll be more than happy to send you my Calendly schedule, and we'll get on a phone call and talk to you more about this. Again, it's pretty much going to be what I've just explained. And I had a patient this morning who had the same exact issue. If the shedding does continue for a few more months, probably we should take out the minoxidil from the solution as well, so you don't get a shock loss from the minoxidil. And that we could do right away. We would just take out the minoxidil and ship you out a new bottle free of charge.
So you
Thank
would
you for that
recommend
question.
taking the minoxidil entirely out, and then would you add it back in at some point?
Yeah, at some point, yeah, no, at some point you could probably add it back in. Honestly, in his situation, I would just get back on oral finasteride. He's just having a shock loss from stopping the finasteride. He's been on it for several years, so his body is used to that. I had a patient this morning who was on oral finasteride for 15 years, and then he stopped, and then he started to lose a lot of hair. Look, your body is used to it. Although you're on oral finasteride and you start to thin out a little more, it doesn't mean that it's not helping you. It's just not as effective as it was before. You're plateauing, but it's still helping you. So when you stop, you're kind of yanking out the whole thing, and you interrupt and disturb the equilibrium. I was shedding 250 hairs a day before starting topical finasteride. After 4 months, I'm still shedding 250 hairs a day. Does it mean it's not working? Actually, no, not necessarily true. You could still be shedding and you could still, having more hair growth. So I would honestly compare the before and after photos and to see how you're doing. If you feel that after comparing the first, I will wait another 2 months. I will give it 6 months. After 6 months, compare the photos. If you feel that you're still losing 250 hairs a day, two, that clinically, look at photos, your hair is not much better, I would add an oral medication to your regimen, and that would include probably oral minoxidil or oral finasteride, or switching out the topical to our kitchen sink, or which is the finasteride and dutasteride, or just dutasteride. Don't necessarily just stop the topical finasteride because you're still having a lot of shedding. You want to add something else to it to really bolster the results. Again, I'll be more than happy to talk one-on-one for in these scenarios to really figure it out. I have a question about hair transplant. Is it true that when you get a hair transplant, you need to do it again as the hair falls out again at some point? Yes, unfortunately, it is true. So let's say patients do hair transplant at the front. The problem is that you're going to continue to shed basically as you go further back. So at some point or another, this is why a lot of patients, unfortunately, end up doing another transplant 10 years later, because now they're thinning basically right here in the mid-top crown. One of the best things to do is, in addition to doing, when you do transplant, you should still probably have something like Happy Head or oral minoxidil or finasteride to prevent the rest of the hair from falling out. You want to preserve the rest. So that's why you still need to do something. The transplant is just not enough. Most products indicate effectiveness for the crown. Is it true? Is that true for the whole head? Great question. So this all comes from the fact that on the topical Rogaine bottle that's sold in the stores, it says you should only apply it onto the crown. Why? The reason why that is because when they did the original studies with the FDA, They wanted to have a basically an easy area on the scalp to really test it on. And I feel sometimes in the front it's really hard to say if the product is working or not. But in the crown is a very easy area to test and take photos and be consistent. So the company did the study only on the crown. So when the FDA gave the approval, the FDA gave the approval stamp only on the crown. Now, that's basically what's called talking by basically on label. I'm a physician, so we could talk off label. So what off label means that we basically talk about things that is that the that it was not it was not approved the way the FDA wanted to be approved. The product minoxidil really works everywhere. It's just the fact that the company Rogaine cannot talk about it that way because that's not how the original study was done. So in essence, Rogaine could work on the entire head, minoxidil could work everywhere, and finasteride could really work everywhere. You're right. The use of Rogaine in the front of scalp is an off-label use of an FDA-approved product, but you can still use it. We have a lot of patients use it, and they do very well. Sorry, complicated. Those are a lot of it's like FDA questions, issues. Can I apply other hair creams when using Happy Head? Should it be before or after applying Happy Head? So yes, you could use other creams, but please use it after Happy Head. So apply Happy Head first, and then apply the other ones on. Guys, I love these questions today. I think everybody came back from Thanksgiving with a lot of good questions. I love it. I noticed that the color of the liquid in my bottle is different than the one I received last month. Is that normal? Yes, it is. Couple of reasons for this. First of all, the reason why there's a color to it is because of the aloe and also the retinoic acid. That's what kind of gives you that yellowish tint. And a lot of those colors change basically based upon the travel time, based upon also if it's cold outside, if it's not cold outside. So right now it's getting a little colder, so basically a little bit more of the retinoic acid and aloe just change color as it gets shipped out to you. It doesn't mean anything, still the concentration is the same, and nothing changes. And also if you take one of the products and leave it out for like 3 to 4 months, you see that it will get darker and darker and darker. So so it's normal, it's not a problem. It's just that's just how it's made. Should Happy Head be applied only to bald or thinning areas, or just the entire scalp with good covering of hair? I will really try to focus it on thinning areas. Will PRP help hair growth? Absolutely, yes, it does. I do a lot of PRP and I do a lot of stem cell, and we do a lot of PRP, and we use Happy Head at the same time. I live near Santa Monica. Is it possible to schedule an in-person consultation? Yes, you can. You have to basically contact my personal office. So just Google Dr. Benham, Los Angeles. We're at the corner of Barrington and Santa Monica. So just give it, and the office number is 310-315-4989. Yes, please come in, and we'll be more than happy to see you. Is twice a day application as effective as 2 ml once a day? Great question. So the only issue with 2 ml once a day is that it could cause a little more of an irritation when it applies so many all at once. But if it's not irritating you, yeah, you could use it. Should I expect, again, the shed when switching from low to high concentration? Again, if you're already using topical minoxidil at any concentration, you should, you should really not see a shed when you move up to a higher concentration. What's the difference between dutasteride and finasteride? So finasteride inhibits one enzyme, whereas dutasteride inhibits both enzymes. So dutasteride in clinical studies was better than finasteride, and we typically start patients on the finasteride to begin with, not necessarily dutasteride. But if you want it, just put that order and we'll ship you out the dutasteride. I've been taking biotin for years. Doesn't do anything. Great question. Uh, to some extent, yes, but it's not a life changer. I've heard that excess hair loss after starting minoxidil. My son is using finasteride gel compounded 6 months. So, so, so people don't necessarily have excessive hair shedding after starting minoxidil. Obviously, if your body has gotten used to it, you're gonna lose that hair growth. But there's no such as a rebound. There's no rebound effect with minoxidil. I've been a happy for a while now. I have been seeing amazing results. Woohoo! No side effects. No side effects. Sexual drive is also amazing. Well, thank you so much. We were happy to hear that. Happy holidays. Do any topical peptides help hair growth? I mean, it's questionable. We're always looking for different peptides, but honestly, in clinical trials, none of them have really panned out yet. How much more powerful is a product by having dutasteride and finasteride? Look, it could really be a lot more powerful. Everyone's different. But again, I always say try one product first individually before necessarily going to the kitchen sink. Hmm. Okay, guys, we have a few more questions and then I have to head out. Okay, I've noticed that the serum being noticeably lighter between ship. I mean, know that the serum being noticeably lighter between shipments last summer. The previous happiest serums were significantly more orange brown. They became much lighter and clearer, yet the chemical might remain the same. What changed? So good question. So we've been working on basically the manufacturer with respect to the aloe. Um, and so that's how we're trying to get the color a little more consistent. So really nothing has changed. Just the fact that we're trying to make the product better with respect to its color consistency. I'm experiencing slight shedding when shampooing hair after using the product for a year with no shedding for 6 months prior to this change. So really, again, nothing has changed at all. There was a time period last year when the manufacturer changed the distributor of the minoxidil, but we're back to where we were and nothing has really changed. Now, you will experience some shedding once in a while just because hair goes through different cycles. And during fall, people tend to shed more, actually. That's normal. So, you're just going through different hair cycles.
We'll add the questions to the next AMA. The
Yeah.
last one is just Stuart. He says, "Oh my God, it works."
Okay, guys. Well, sorry, guys. Our time is up. We're gonna add the rest of these questions to our next AMA. You guys have a great week, and again, happy holidays. And we're gonna see you guys next week. Have a beautiful day.